We begin this evening with an update in the fight to eradicate malaria. A new report says the mosquito-borne disease caused by a parasite could be wiped out in a generation if $2 billion more each year would be invested in battling the disease. However, there is an ongoing debate over whether the global community should make eradication its primary goal. Henry Ridgwell reports from London.
Malaria kills around 435,000 people every year, most of them children. Significant progress has been made this century in fighting the disease, with the number of deaths dropping by half since 2000. The new report, published in the Lancet Medical Journal and written by 41 of the world's leading malaria experts, says the disease could be wiped out within a generation, but it won't be easy.
So, you might think that actually right now that's the trajectory. The challenge is in the last couple of years, things have stagnated.
Just 5 African countries account for half of the global malaria burden. Burundi is in the grip of a malaria outbreak. Doctors say there's an urgent need for investment in healthcare.
Everyone should know that malaria is a disease of the poor. And then, as I said in terms of national health policy, malaria remains the leading cause of death.
The report authors estimate that $4.3 billion is spent globally on fighting malaria each year, but it says another $2 billion will be needed annually to wipe out the disease by 2050. It will also require new tools, which might include so-called gene drives that could make mosquito populations collapse or render them resistant to the malaria parasite.
We need every piece of the jigsaw puzzle. So to say that just controlling vector would be the magic bullet, or just coming up with a new drug would be the magic bullet, I think most would agree that's naive. I think we need the new frontier of tools that maybe don't even exist yet.
A malaria eradication program was attempted in the 1950s, but abandoned a decade later. New focus and investment in recent decades, particularly from the Bill and Melinda Gates Foundation, has given renewed impetus. But there are some concerns.
The last thing we want is to start saying we're marching towards eradication, but then you get that donor fatigue and stakeholder fatigue of we're just not getting there, we're just not making progress, this is failing.
The United Nations says better overall healthcare is critical.
Without adequate healthcare, people-centered, properly financed systems, we will not achieve eradication.
The Lancet report authors say malaria eradication will require huge ambition and commitment, but the social rewards will be worth the investment. Henry Ridgwell for VOA News, London.